Hello, I am Chris Pickard, Director of Body Imbalance in Hertfordshire. Yes, it is the summer of 2018. It is still really hot. And today I'm going to be talking to you about, can I get this? Knees, or rather knee pain. Knee pain, just like shoulder pain, is a massive problem in the UK. It's even more of a problem than shoulders. Knee replacements cost the NHS maybe almost £500 million a year. And this is just from arthritis and other problems eventually leading to a knee replacement. Knee arthritis itself, just in my local area in Welland Hatfield, it suffered, I think, 17,000 people, or it might be 7,000 people suffer with knee arthritis. 40,000 in the whole of Hertfordshire suffer with arthritic pain, and that's just one of many knee problems. So I'm going to be talking to you about where knee pain comes from, and then I'm going to talk through some simple things to try and ease your pain, perhaps prevent problems in the future as well, and what to do if you have a serious problem that these simple things don't work for. So, number one, what is the knee made of? This is going to help you understand what you might need to do. So first of all, there's bone. And so bony knee pain can be from arthritis. It can come from osteopenia as well. So you can also get fractures in the bone as well. Now, hopefully you're going to know if you've got a fracture and you know that you need to go to hospital to help you. Then you have ligaments. Ligaments are the things that hold the joint together. The most famous ligament is the ACL, or the anterior cruciate ligament. It's often the one that you see many footballers, if you're in the UK, or American football players, basketball players get. It comes from twisting injuries to the knee. And if the ligament is completely torn, well, the conventional wisdom is that you need surgery. However, I have some patients who had full ACL tears years ago and they didn't need surgery, and it seems to have stitched itself back together again. However, I would say surgery is probably the best thing to do with a full ACL tear. Partial tears, there's a lot you can do. Simple stabilizing routines, of which I will show you one shortly. Then there are ligaments at either side as well. A lot can be done to help those. Then you have the cartilage, which is like a washer that sits between the upper and lower part of the joint. And the cartilage, this can be ground down, it can be torn from different injuries. Then you have the tendons, which tend to come from overuse, but there's also chemical reasons why tendons can inflame and cause tendonitis. And there's bursas, fluid-filled sacs that stop the tendons rubbing on the bone. They can all become inflamed. So what causes all these problems? Well, as I said, you can have sudden impact injuries, but there's two basic causes. There's mechanical problems and there's chemical problems. Well, let's look at the mechanical problems first. Mechanically, you can either have a sudden injury, so playing football, getting tackled, jumping, landing awkwardly, car accidents where your knees go into the dashboard. That often causes a posterior cruciate problem. But then you can also have the sort of repetitive use where you're doing something in the wrong way repetitively, or you could be doing something in the right way, like just some walking or running, but you've got a muscle imbalance somewhere else that puts more pressure on the knee or causes the knee to go out of alignment. And this is commonly caused by weakness in the ankles or weakness in the gluteal or the hip region, because the muscles in your backside actually support the knee. And so if those go weak, it could cause back problems, it could cause hip problems, it could cause knee problems, it could cause all of them. Or it could just cause one. So your knee pain may actually be due to some problem somewhere else. It can be because your back and your pelvis is twisted. It can be because of balance receptor problems in the back of the neck, causing more problems with your knee. And also, and this does happen with chronic recurrent problems that keep on coming back, I found very often it's the jaw, because the jaw is an amazing balance receptor. And if the jaw is out, then your brain gets faulty information. And so if you're running around twisting and and diving and bending around, it can cause a lot of extra strain on the knee and keep causing you to injure your knees. So if you do have a recurrent problem, it's really important to get the jaw, the neck, the back, the ankles and the hips all checked if you have a knee problem. I just want to say hello Stefan, hello Caroline, hello Mercedes, hello Curly, hello Mr. Clive Piper as well. There you go. Sorry if you're watching this on YouTube later. So you have lots of different mechanical reasons and lots of imbalances. I'm going to show you a simple thing to help protect the knee in a moment. Now the other reason that so many knee problems occur, whether it's a tendonitis or keep on getting bursitis or where you've got arthritis, isn't just mechanical wear and tear, but it's also what's happening chemically on the inside. Now a lot of people always think that wear and tear is just, it's old age, it's wear and tear. No, it's either imbalances or it's chemical problems or it's both. And chemical problems come in two forms. One is your knee is not getting enough of the right nutrients to keep regrowing the cartilage, to keep regrowing the actual covering of the knee, to keep getting more fluid in the knee, to make it all smooth and easy. Not getting enough nutrients to make sure the ligaments and the tendons and the muscles stay strong. And the other chemical reason is that certain chemicals that you're eating or you're breathing in or you're drinking, certain pollutants and toxins, but also some things that are actually in food like tomatoes, in some people it can actually cause pain and arthritic symptoms. And these chemicals that get into the knee joint cause inflammation. Now a lot of people are really skeptical about the whole chemical side of arthritis and knee problems and joint problems. Yet, what's the first thing that a doctor gives you when you have any kind of joint pain or problem? They give you a chemical and you expect it to work. Now, how does that work? Because it's a chemical and it's working through pathways, chemical pathways that are already in place in your body. And there's a new horizon of arthritis treatment on its way, looking at a particular protein. And they're injecting a certain chemical that stimulates this protein receptor and it brings down inflammation and stimulates the regrowth of cartilage. And the thing is, there are things you could be eating right now that could be making that worse, and there are things you could be eating right now that make that better. So, I'm going to reveal the number one thing to avoid if you have got chronic knee problems, or shoulder problems that is, and that is wheat and grains. All grains, whether it's rice, whether it's wheat that you find in pasta, bread, toast, cereals, whatever way you're getting grains into your body, okay, because grains contain lots of phytic acid and there are other things that contain phytic acid really robs your body of sulfur because you need sulfur as part of your detoxification pathways and phytic acid uses up a lot of sulfur. I don't know the exact reason why. And one of the places you find lots of sulfur is in cartilage, and the biggest cartilage is in your knee joint. And so you need your cartilage to be repaired all the time. So if you're doing things that rob your body of more sulfur, you're going to hit into all kinds of problems. So you must do things to lower phytic acid in wheat and grains if you have a knee problem, especially if it's recurrent and long term. Other things that produce inflammation in the joint are too many omega-6 fats. So you can get omega-6 fats from you having too many vegetable oils. That's processed vegetable oils, not usually the oil that's in the vegetable, because that's got other things happening with it. So rapeseed oil, sunflower seed oil that you're using for cooking, just avoid those. Olive oil is okay. And the other thing is red meat. Most red meat, cows are fed grains and other things, and so they produce lots of omega-6 fats, not omega-3 fats. So whereas grass-fed beef tends to have a lot of omega-3 fats in it, most meats, red meats and certainly all processed meats are going to be very pro-inflammatory. So avoid grains and avoid red meats, especially processed meats, if you've got a lot of chronic knee problems. Now let's have a little question here. Stefan is asking, so feeling my pulse in my knees while running ain't bad, only pretty uncomfortable. Feeling your pulse in your knees. So does that mean that you're actually feeling some pretty uncomfortable. That could be down to a lot of things, Stefan. So try this exercise. So the first thing I want you to do is, if you've got chronic knee problems, is just get rid of phytic acid, or at least lower it. There are other reasons why wheat causes inflammation and problems on the liver, and that's something called glyphosate and other pesticides and herbicides causing fatty liver. So let's actually now show you one single knee exercise that may help a lot. So here's a desk I prepared. Here's a leg. Okay, and can you see that properly? No, you can't. Let's just swing this around here. Let's go this way. I should have really checked this out first of all. There we go. Here's a knee. It's straight. What I'm doing is point your toes towards your head as hard as you can. Okay, and then really tense your knee muscles, like you're really trying to straighten your leg. Okay, and keep that locked for about 15 seconds. And that's going to really strengthen muscles all the way around the knee, but it's also going to stretch the hamstrings. It's also going to start strengthening a muscle in the back of your knee, which is really hard to control, called your popliteus as well. So really point your toes towards your head, lock these muscles. Now, and that's going to provide a little stretch, and it's going to work on here. Now you can actually make it a little bit better still by doing the same thing. Okay, point your toes towards your head, lock the leg, but then lift it up. So you're going to really work on the quads. Now you can also do this with your legs slightly turned out, and you're going to get the vastus medialis muscle a lot more. And this muscle is often weak, and this causes a big imbalance side to side, from the inside to the outside of the knee. And this often then causes your patella, this bone here, to track wrong. And most people need stronger vastus medialis, the muscle on the inside of your knee and your thigh. So point your toe towards your head, lock the muscle, lift it up, hold that for 15 seconds, then do the other side, and then try it with your leg turned out for 15 seconds. And then same, point your toe towards your head, lift up, and then turn your foot in and up. Now, Carolyn, you've asked how high should your leg be raised? Well, first of all, just try straightening the knee. And you can have the foot rested on something, or you can just sit down and just lift it a little bit and straighten the leg. But then if you really want to strengthen a lot more muscles, then what you do is you point your toes towards your head while standing, and then you just lift your leg up and you hold it for 15 seconds. And that's going to get a lot more muscles around the side here. You can also, if you want to strengthen a lot more hip stabilizers, try lifting your leg up to the side, and you can also try it with your foot turned in, your foot turned out more, and you do that on each side 10 times. So really, how high you hold your leg depends on how strong your leg is. And believe me, even just doing that seated, just straightening your leg, pointing your toes towards your head is a great place to start. Sitting, lifting your leg up a little bit so that your back of your thigh comes off of the chair or the bench, that's going to help even more. Standing, it's an even more killer exercise for your lower back, your pelvis, a whole lot of things. Now, I will end up putting this on YouTube. I will end up putting this on a page on my website. If you go to my website, thepainreliefcenters.co.uk, and you click on treatment or conditions, just click on that link, look at the page, go down the page. I've now actually added shoulder injuries, so I've got a whole load of shoulder resources there now, and I will put the knee resources there as well. So yes, 10 to 15 seconds, Stephanie, you hold it, you contract, you lock the knee straight for 10 to 15 seconds, then you relax, then you do the other one, and you do each side 10 times once a day. And if you find it easy, you make it harder by standing up, raising your leg higher, trying it out to the sides, trying the foot turned in and out. But mostly it's the vastus medialis that's weak. So if you turn your foot out, so you've got the inside of the leg up, you're going to be using that muscle more. And that really helps a lot of patella tracking problems. Now, there are lots of other knee exercises, lots of other things you can do. If you're finding that just a simple knee locking exercise isn't making your knee more stable, because it does do more than just the knee. If you're finding removing grains, if you're finding that you're not really getting any significant change, then call me. 01707 662 704, book an appointment, or if you're far, far away, we'll try and find someone closer to you. Be well and live long and prosper in peace.